Welcome to the Research Works podcast, brought to you in association with the Healthy Strides Foundation. Your hosts are Dr. Dana Poole
and Dr. Ashley Thornton, and we're here to interview world-leading researchers, clinicians and people with lived experience
to support your practice in being more evidence-based. Okay, we're back here for another episode of the Research Works podcast, and we don't have Ash today, but we do have Marissa.
Good morning. Thanks for having me back.
We love having you back. The Q&A last week was really fun.
I love doing that.
That was heaps of fun. So well done to Ed for asking us all those questions. I was nervous, but it was good.
It was great. I was very impressed, and what good discussion.
I know. We had a great discussion with that. And so, I've been having lots of texts and people sort of commenting about how much they liked it. So I'm glad you guys enjoyed it. And today is no exception because we actually have a guest in the studio.
I know.
Yeah.
It's so nice. We didn't have to go through all the protocol with the screens, etc. So nice to have you in the studio.
So welcome, Dr. Maya Hayden-Evans from Curtin University.
Hello. Thank you so much for having me on.
Oh, it's great to have you here. It's always nice having someone in the studio to have a chat. And today we're going to be talking about an article that was recently published. And I have to say, well, it's very long, so I'm going to wait for it. But anything to do with the ICF, it has got a long title, doesn't it? So hold on to your horses, guys. This is what this article is called. It's called Validating the International Classification of Functioning, Disability and Health Core Sets for Autism in a Sample of Australian School-Aged Children on the Spectrum. This was published in the Journal of Autism and Developmental Disorders just earlier this year. But wow. Whew.
It's huge. Very excited to get into this because I have a lot of questions.
So many questions.
And a lot to learn. So I'm really excited to get into this more.
Yes.
But for our listeners, I'm going to tell them a bit more about you, Maya.
Okay.
So Dr. Maya Hayden-Evans is an expert in the field of disability and health, particularly focusing on autism spectrum disorders. As a researcher with the Curtin Autism Research Group, she has contributed significantly to the validation of health-related measures for children on the autism spectrum. Her recent research emphasises the use of the International Classification of Functioning, Disability and Health, the ICF Core Sets, to assess functioning in school-aged children with autism in Australia. Dr. Hayden-Evans' work aims to improve the accuracy and relevance of these measures, ensuring they reflect the lived experiences of children and their families. Her findings underscore the importance of refining current measures and recognising the complex interplay between environmental factors and child development.
How awkward is it when someone reads your bio in front of you? It's always like, squirm.
It's amazing.
But it's great. And I was just saying to you before, I'm like, are you an OT? I always try to make guesses, and I was right.
Yes, I know, good guess. Do I look like an OT?
We do make jokes about that, don't we?
We do.
How can you tell? But I don't know, there was an OT vibe.
Yeah, okay.
Yeah, I don't know what that is. I'm not sure I can... Speeches usually dress like really well. They wear high heels and stuff. Physios definitely always wear runners. Yeah. And OTs are kind of right in the middle.
Yeah.
Like dress really well, but very practical.
Yeah.
Yeah, that's a stereotype.
There is completely the stereotype, yeah. And then we can start asking about basket weaving, which I think OTs always hate when we talk about that. It's always a funny joke.
See, I think I've let down the OT team because I'm like a not crafty person at all. So don't ask me to weave any baskets.
I love that. Well, I felt like that was a good icebreaker.
That was a great icebreaker. So now we're going to go to another really random question. The icebreaker question for today is, would you rather win $50,000 or never have hot chips again?
I should have checked to see whether you're into hot chips. We were trying to find out an icebreaker question in the office yesterday, and many were thrown around, and this one stuck.
Yeah.
Great conversation around this one.
Yeah.
Do you like hot chips?
I do love hot chips.
Great. This is a good one then. Yeah.
Like, I think if you had asked me what food that I could only eat one food for the rest of my life, I think I would pick hot chips.
Oh, that's hard then.
So,
okay.
I think this is really tricky. And I don't know that I could give up my hot chips for, how much was it?
50,000.
50,000.
For the rest of your life.
Yeah. See, I don't know if it's worth it. I think I would have to pick the hot chips.
Yeah.
Yeah. And I actually worked at a fish and chip shop from like all through high school and then through my undergrad degree. And so I've eaten a lot of hot chips in my life. And I still think
this was a great question.
And I still think that I haven't had enough.
Can I ask then, on your chips, are you the vinegar and salt, or are you chicken salt, or what do you put on top?
Chicken salt and vinegar.
Oh, yeah.
But you have to put the vinegar first.
So it sticks.
Yes.
And what's the secret, seeing that you have worked at the fish and chip shop, just digressing now, what's the secret to like a really good hot chip when you make it? Like, Is there anything that we need to know?
No, I don't think there is a top secret. I like them to be like a little bit crispier. So I think leaving them in the fryer for like a tiny bit longer, that's the,
I don't like
the
them
ultimate.
too blonde. Yeah. I want the, oh, this is going to make me hungry. Bad question.
What would you do?
I would definitely pick hot chips. That was just a no-brainer. I think the original question was going to be around $10,000. I'm like, oh, no way. $50,000 made me think about it a little bit. But for the rest of my life, I always say there's two food items that if I could eat for the rest of my life like you, it would be hot chips and ice cream.
Yeah, that's all you need.
I can eat. That's all I need. Vegetables and dairy. About you,
I would take the 50,000 only because I have lots of other things I really like.
Oh, okay.
So I could have, as long as there's some other carbohydrate that I could have with cheese and oil, like a garlic bread or cheese bread or pizza, I'd be okay with cheese and oil. Maybe not with a carbohydrate and put it in an oven. Maybe not a potato, but I think I'd take the 50,000 because that could buy me a lot of other yummy things.
Oh, interesting.
Okay.
It's a lot of dinners.
It is a lot of dinners. I feel like this question tells you a lot about a person.
Yeah.
It does.
I like that. It would have been boring if we all just went for the hot chips, actually.
I know, that's what
You've really thought about it. Well done.
Thanks. Because $50,000 is a lot of money. Like, let's put that out there. It's a lot of money.
And garlic bread is good, but I don't know that I could make the sacrifice.
Oh, just hot chippies, gravy and hot sauce. Oh, a load of chips. Oh, so many options.
We might be getting some today.
I think we might be.
Well, you won't be.
What's for lunch?
Yeah, I won't be.
Okay, well, that had nothing. Normally, I try to see if there's a way we can weave this into a conversation, but I don't even see how hot chips does. But let's give everyone a bit of a rundown of what we'll be talking about today. So this article focuses on validating the International Classification of Functioning, Disability and Health Core Sets for autism in an Australian sample of school-aged children on the autism spectrum. The study aimed to assess the applicability of these core sets in measuring functioning, particularly in areas of body structure and functions, activities and participation. Caregivers of children on the spectrum were surveyed, with results showing that while the ICF Core Sets effectively captured issues related to body functions, activity and participation, the findings on environmental factors were less conclusive. And the study suggests that certain areas not currently included in the ICF Core Sets for autism may need further investigation, and that language used in the measures should be revised for clarity. Ooh, lots to talk about there.
Yes.
Lots for me to learn about today. Yeah.
There is. I'm really excited to jump into your study more, but I want to start with just going into a little bit more about autism spectrum disorder and a little bit about, because obviously it's something we're hearing more and more about. And I know over the last 10 years, I know so many more people who are getting a diagnosis of ASD, and even just for my own awareness, and I know for other clinicians, learning about it being a spectrum, it is so varied, and that means the diagnosis and the process and the age of onset can be quite varied. Mm-hmm. But can you talk us a bit through about the diagnosis of autism, when that occurs and how it could be made?
Yeah, okay. So in terms of diagnosis, I guess that can look so different for everybody, like you said, because it's a spectrum, and there are a lot more people sort of going for diagnosis now as older people, whereas I guess traditionally we see, it's, something that you would pick up in childhood, but that's not necessarily the case.
Yeah.
And as you said, we're sort of seeing a rise in that number of diagnoses of autism because of, this increased understanding that we're having around how autism actually presents in, different people, and sort of then being able to pick up some of those things now and being able to support those people who've maybe, gone their whole life kind of just not really understanding why they've been experiencing the things that they've been experiencing. And so the diagnosis process now, there's, a whole guideline that's been published around that. And like we were talking about Andrew Whitehouse and that work that they've done on that guideline that gives people an idea of the process, I guess, of diagnosis. And so, it's such a comprehensive process in actually getting a diagnosis. It can be, there's a lot of assessment and a lot of sort of consultation with different professionals that kind of goes into that. And so, as OTs, I guess we're not necessarily involved in giving somebody a diagnosis, but more around that sort of functioning assessment, which is, it sort of feeds into a diagnosis and kind of goes hand in hand with it.
Yeah, sure. Part of the bigger picture, I suppose, isn't it? Yeah.
And can you tell me a bit more about what age is like the average age for an autism diagnosis? And obviously I know it can vary as well.
I would say the average age, so we're seeing the prevalence of autism is highest among school-age children, so that's our sort of biggest group. And I guess because when children start school, they start to see that increased demand of social situations and things that, you know, maybe they were able to cope at home with mum and dad being able to kind of I guess, shelter their children a little bit. Whereas then when they go out into school, it's sort of all these different things coming at them. So that's where we see a lot of people then seeking a diagnosis once they start school. So I would say that's sort of the average.
Around the early school age.
Yeah.
That makes so much sense, though. At that age, so many things happen, right? You've got so many more social demands, cognitive demands. Everything comes in at that point. It's a lot to cope with.
And that kind of associates with ADHD as well, doesn't it? When that's around 7 years of age, when it's those increased demands of school and socially as well.
Yeah.
So can you tell us a little bit more on that topic about other co-occurring conditions that are common with ASD?
Yeah, so like you said, ADHD is obviously a big one that kind of goes along with autism, and there can also be differential diagnosis. So that's because often the way that they present might be similar. So, you know, for kids going through that diagnosis process, having to then determine if it's, you know, do they have autism, do they have ADHD, is it a combination of both?
Sure.
But the rate of ADHD along with autism is quite high.
Okay.
And then, other neurodevelopmental things, I guess, like we see earlier people have maybe sort of developmental delay, which then once it gets to a certain point, it's like, oh, actually, could it be autism? So taking those things into consideration as well.
Yeah, sure.
That gives us a great background on autism. I know we could speak about for a long time because there is so many questions, and more questions are coming through my mind. But I really want to bring back to what your study was about in terms of focusing on validating the ICF Core Sets for autism. And why did you choose to study this in an Australian sample?
Yeah, okay. So I guess like we were talking about in terms of autism being such an area of like within our National Disability Insurance Scheme, seeing such a big group of people accessing that service have an autism diagnosis. And so there is then this need to assess functioning accurately and to be able to then, you know, make sure that those people are supported in the way that they need to be. And when I set out to do my PhD looking at assessing autism and functioning in autism, we did a review of the literature to look at what assessments were already out there and mapped those to the broader ICF framework and found that, you know, there are a lot of things that sort of look at body functions, or they look at activities and participation, or they might look specifically at, you know, environmental factors, but there wasn't one assessment that looked at all of those things.
Sure, okay.
So then that brings us to then the core sets had already been established, and the process for establishing those core sets is quite rigorous. There's, you know, a whole process that's endorsed by the World Health Organization that actually, you know, gives us an idea that those are valid, I guess, a tool that we can use. And so that we use that then as the framework for developing a new tool within our context. Because a lot of the work that had sort of been done around those ICF core sets was in Sweden, where, so actually one of my supervisors, Professor Sven Bolte, is, he was involved in the development of those core sets. So a lot of that work was being done in Sweden, but we know that, you know, culturally context can have an impact. So, you know, do those things actually still apply in our context in Australia?
I see. So just so that I'm making sure I understand the core sets properly, the core sets is, so under the ICF, there's a whole list of different body structure and functions, whole list of different activities and participation. Like I'm pretty sure I've seen the manual before, and it's massive. It's like if anyone remembers phone books, it was kind of like a phone book. So under all that, obviously it lists heaps of different things, but for a core set for autism would be something that be selected items that would be relatable to that particular diagnosis, and that becomes like a description, I suppose. Is that what we mean?
Yeah, that's right. So the ICF, like you said, is a great big book, and there's, I think, something like over 1,600 codes.
Oh, is that many?
Yeah, within that book, and that's sort of description of all these different things that can affect functioning across like anybody. They can be applied.
Right, okay.
With the idea with the core sets is that they are sort of subsets of codes from that grader manual
Yes.
that are relevant to specific health conditions. So
I
in this
see.
case, we're looking at the autism one, but there is, one for ADHD, one for CP, one for depression. Like there's, all these different ones, and sort of they have been determined by experts to be, the most relevant.
Okay. So in your study then, so there's already an existing core set. Can you just explain why you wanted to do this study to, I won't answer it. Can you explain to us why you wanted to do this when there is already a core set?
Yeah. So the core set obviously already existed, but what we wanted to determine was whether that was a suitable framework for an Australian assessment of autism.
Yeah.
And so that's why we combined it with the ADHD and cerebral palsy core set to kind of make this bigger neurodevelopmental condition set so that we could then apply that to when we were working with parents of autistic children and see if the items that they thought were most relevant were the ones that came from the autism core set,
Yeah, I love that. So it was really trying to match up what the consumers were looking at with what has already been sort of established and using that expertise to develop it. I love that. That's really cool.
So can you go into now a bit more about how you actually went about investigating this? What was your process? And
in terms of like how we collected the data? Or?
Yeah.
Okay, so like I said, a lot of work went into, I guess, producing this bigger core set so then establishing that we were going to use this neurodevelopmental condition core set. And that includes, so I guess a little bit more background about the core sets is that, so there's a comprehensive autism core set, which covers across the lifespan, so from like 0 to 17 plus.
Oh, wow, okay.
And then there are specific like age core sets. So there's one for 0 to 5, 6 to 16, and then 17 plus.
Right.
And so I was looking at school age and obviously expecting that the core set for the school age children would be the most relevant one.
Yeah.
But we sort of embedded that within that more comprehensive autism and plus the other ones.
Sure, okay, yeah.
And then what we did was we actually developed a sort of like a way to use because like you said, the ICF core sets already exist.
Yes.
So anybody can go and like download them off the ICF website. But it's just a documentation form, like it's a black and white, like very like busy, complex sort of thing. So we took that and we made it into a more user-friendly tool, I guess.
Beautiful, yeah.
And that we created like a set of cards that had a picture on it and like the definition on the back.
Yes.
And then we asked parents to sort of set them out on a scale, and they did it as so it was a proxy report, but we sat in the room with them so that when they had questions or, they didn't understand something, then we could then clarify that with them. So we didn't just give them a form and tell them to go off and fill it out.
Yeah, which can be really hard because the way that some of them are described doesn't feel particularly intuitive.
No.
Right? I think you do have some examples of the pictures in your paper, in your article itself. So it'd be really worthwhile having a look at that, which makes so much more sense. Can you give us an idea of like how many core sets they were that you guys looked at in terms of how many items? Sorry, not how many core sets, how many items?
So there
roughly?
I'm trying to think. So there's 100 and something in the autism one.
For the school age one?
For the comprehensive one.
Oh, the comprehensive, okay.
And then obviously plus the other one. So there'll be a couple of hundred like items, I guess, in terms of, so we had these cards and the parents had to, do them all, which was a very long, extensive process, but then that helps us to kind of whittle down to the ones that are really the most important to look at.
I mean, you can't start with something too little, right?
Yeah.
Because you want to try to cover the whole breadth of it. That's a lot of cards.
Yes, it is. And then we had to sort them all at the end once we'd done them all. So there's a lot of,
That's the fun of a PhD,
exactly.
isn't it?
I love
These
the
are the things you
idea,
remember.
though. I love the idea of having a card. And when I saw the examples in your paper, I thought it's so clear. And it's good because sometimes on a form, when things can become overshadowed by what's above it or below it, and the volume of what you're going through can be daunting. But to actually see it and think, does that apply? Is this important? Be able to rate it.
Yeah, and just to have it one at a time and then focus on that one thing, it makes it a lot easier.
Because you're right. If it was just a survey and a form that you're filling out, like, I don't know, it's just those fatigue associated with that, right? It's not, you need something where you're moving and actually seeing it, and it's a bit more tangible. Otherwise, it's like, tick, 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 tick.
Yeah, exactly.
The
way they were
answer.
physically like placing them down.
Yeah, what a great idea. Love that.
I think it allows you to really hone in then on the responses on what the family's wanting to say and what the outcomes of what you can get from the survey.
Yeah.
Can you tell us a bit more about the home visit component?
Yeah,
OT assessment.
Yeah. So, and that was part of a broader project where, so this was just one component, and then there was other things going on where we were doing standardized assessments with the so the home visits were like 3 hours long, so it was a lot for the families. But we would go out and sort of see the child and then talk to the parent, and they would fill out this, do the survey with us, but then also filling out these other things, and we would do observations and things like that. But that was obviously part of a broader project. So this paper specifically focuses just on that parent report part.
Okay. Because the assessments that you listed in here, there was like the Pedicat and there's the
Vineland.
The Vineland, yeah. So that was, you assessed that in this home visit, but you used that as part of a bigger study.
Yes.
Right.
Yeah, that's right.
Okay. Yeah. Cool. Gosh, that's very comprehensive.
Yes, it was. I very much appreciate all the families who took part.
It's incredible, isn't it, when you think about the time that families put into this, like they're invested into this too, and they see value in the whole project, which speaks volumes about why we need to do this.
Yeah, exactly. And we couldn't do it without them. It's really important.
Yeah. And how long did that process take? Like, how many people did you include in the study in the end?
So I think there was over 120 families who we actually did the whole process with. Some of them obviously fell outside of the range for this paper where I just reported on the school age.
Sure.
But we did actually do the same assessment process with younger kids, so from the 0 to 5 age. And then we did 17 to 21, I think was then the upper end of that age range. So
it was a lot of home visits.
It was a lot of home visits. And we did
that by 3.
Yeah, we did that all over Australia as well. So we we went over east and visited families there. So it was good.
Really representative then, from a range perspective. Okay, cool. Thanks for explaining all of that. It's a lot of work. So now that you've collected all of that, let's get into the results. And I love going through the process of things before we get into the results. So I feel like sometimes the results are just like, you can rattle them off in a few lines, but the work that it takes to get to that place is huge. Yeah. But I guess for you, if you were to summarize it, what did you find from all of that? Yeah,
okay. So what we did find, I guess when we set out to do it, we sort of hypothesized that the items that the parents would sort of endorse, I guess, as being the most relevant to their child, or, the things that they struggled with the most or things like that, would be from that school-aged core set. Yeah. And then what we found was that generally that was the case in terms of the body functions and the activity and participation items. Most of them were from the school-age ICF Core Set for autism, or they were from the comprehensive autism. So they were... but then when we came to the environment, that's where things were sort of a little bit more spread, I guess, in terms of what people thought were important, or sort of what came up as a facilitator or a barrier. Okay,
we'd love to delve into that. Should we go through the body functions and what were some of those? Can you remember some examples? I know there's a lot, but maybe the main top few that come to mind.
So I think in terms of body functions, so things around, I guess, the like cognitive processes, so things like organisation and those higher level mental functions. That was the things that the kids struggled with in terms of being able to organise themselves, or so those sorts of things were the ones that sort of came up as being the most difficult for the children. Yeah, and then in terms of our activity and participation, I guess we would expect to see in the area of like communication or interactions with other people, because that's sort of those core features of autism. That's where we would expect to see some of those difficulties being, and that was the case. That's what we saw.
And there's the idea that from those identified items that you like prioritise to assess them through another standardised assessment, or like what's your thought about how we use that?
Yeah, and I guess that's the idea with this, is that sort of it's a way of collecting information and giving clinicians a sort of, I guess, an idea of where
to start.
To start and what to look at. Yeah. And then I guess you can then from there focus in on, if this is a difficulty, why might that be? Or, how can we explore that further?
That's really cool. Yeah.
It really helps with that goal setting and I guess planning in terms of, future direction and that collaboration with the family and bringing all that together.
Yeah.
Now, you did touch on this, that the environmental factors were less conclusive in the validation process. Can you talk to us why you think this was the case?
Yeah, look, I think with the environment, it's and this is something that it's not, so what we saw in the existing assessments is that environment is quite often forgotten when actually it's such a big factor in people's participation. You know, it can be a disabling factor for some people where they've got all the skills and abilities to do a certain activity or participate in something, but then it's something in the environment that prevents them from actually being able to do it.
Yeah.
And so what we saw actually was with the environment. So in the ICF, traditionally, it's sort of it's on a continuum. So they look at it only as like purely a facilitator or purely barrier. Where we actually split it into two. So we asked the poor parents to rate each of those twice. So they said how much of a facilitator something was and how much of a barrier it was, because we know that, you know, things can be in different situations. They can be, you know, both. So you know, you might have a really good teacher who actually really enables that child's participation in school, whereas like another teacher might be, you know, less good and then actually be a barrier to them being able to do what they need to do in school.
Yes.
So that's where we gave them the opportunity to kind of, you know, rate them as both.
Yeah.
And what we did see, I guess, because we used that broader neurodevelopmental core set, a lot of the environmental factors that were not specific to the autism core set were still relevant for school-age kids with autism. So I think one of the ones that came up actually was assets, and so that's come from one of the other core sets, so ADHD or CP. But that was actually seen as, you know, a big facilitator, because parents sort of like, well, we have the financial means to be able to support my child,
I see. Okay.
but that's not included in the autism core set. So that information would be missing if we didn't have that. You know what I mean? So it's sort of
So actually, even stepping back and being a bit broader is actually quite important. So you're not honing in too quickly and making assumptions almost, I suppose, is what could happen.
Yeah. And it just goes to show, I guess, that, you know, maybe some of those environmental factors that are considered relevant to these other neurodevelopmental conditions, there's a bit of overlap maybe with autism as well. So, yeah.
Can you give us any more examples on that? I found it really interesting. Like assets was something that I wouldn't have, you know, thought of to even have there, which is why you have these core sets to remind you. But are there any other examples of things that really stuck with you about some barriers or the most amazing facilitators?
Yeah, I think family comes up as like one of the biggest facilitators. I think like it was like 90-something% of people who actually did say that their immediate family was, you know, a great facilitator for their child. So, you know, that's really good to see. But some things that do come up as barriers, which is quite, I guess, disappointing, is that around the sort of societal attitudes. So things like that being disabling or, you know, being a barrier for people is something that continues to sort of be an issue, I guess, and something that needs to be addressed. So,
but how good is that to know that? Because in terms of family, it feels quite natural for that to be the case. But if some children don't have great family supports, then we know that we need to identify them and find support, either if it's other community supports or something to put around them, because that becomes something that's like you said earlier, like it can be quite disabling in that sort of way if you don't have that kind of support. Or even if I'm just thinking of education and making sure that education is provided when we're providing interventions. It's just not to that child, it's the family network and making sure everyone comes along for that journey for it to be something useful. Yeah, and I think obviously we were quite fortunate, I suppose, in the families that we maybe worked with, like they were willing to put in that time and commitment. And so it makes sense that those families would say, yes, we're really supportive. Yes.
But, you know, you also have to think about, you know, kids outside of the research study who, you know, maybe don't have that support.
With the barrier of societal attitudes, can we just sit on that one for a little bit? Because I feel like that one's, you know, it's such a significant one in terms of what then facilitates participation and your willingness to get out there and do things. What are your thoughts on that in terms of what can be done?
Yeah, look, I don't know. And I think things are moving in a better direction. We're seeing a lot of, I guess, like more positive representation and more accurate representation of autism. But, you know, there's still those sort of stereotypes where you think of like, you know, some of the TV shows and things where, you know, that's just one perception of autism and it's maybe not representative of everyone's experience. So things like that to be mindful of, you know, because people do then, I guess, go, oh, yeah, well, I saw this show about someone with autism, so you must be like that. And that's not, you know, the genuine experience of somebody that you might be, you know, working with who's autistic or, you know, so I think really taking the time to get to know people and understanding them as a person is just, you know, a basic sort of human experience.
Yeah, that's so important.
And I think that's the hardest thing. It's that generalisation, but being a spectrum, you can't really make those generalisations. Because I've had that with people that I know who might be diagnosed with autism or speaking to parents as well, is that they'll have other people make comments and they're these generalisations based on either autism or a child with autism who might have an additional diagnosis of ADHD.
Yeah.
And so then whether people are, they're just making generalisations that isn't always easy for the parent particularly.
That's right, yeah.
And it's this...
Always having to explain themselves.
Yeah.
Always having to... That's exhausting.
Yeah.
So it's around that, at times, lack of understanding. So I guess the more, which I feel like you said is happening more and more, that education around what does autism look like, even now using that it's a spectrum disorder, giving that awareness.
Yeah.
And like you said, that it can be differentially diagnosed ADHD, but they can coexist together.
Yeah.
So I think the more that is out there, I think for families, even in that school context, is so reassuring and validating.
Yeah. So should we talk a little bit more about, I know you talked about the core set we used looking at ADHD and cerebral palsy. So there's some commonalities within that, right? And I saw that in your paper you said there was 37% of children also had ADHD. And also would have difficulties with attention, so that they can be two separate things. But can you help us tease that out a little bit to understand how we can use, the core sets for ADHD and cerebral palsy? Yeah, how does that work?
Yeah, so I guess the idea behind those core sets is that they would be the most relevant for those conditions, and we use them as a way to sort of, I guess, verify that was the case. But you're right in terms of like attention. That might be something that, someone on the autism spectrum struggles with, but it might be for a very different reason to someone with ADHD, where I guess that's sort of the underlying mechanism where attention is maybe is the issue. But for someone with autism, they might have difficulty attending because, the lights are too bright or the sounds are too loud. So you're thinking about, what is it in that is actually affecting that person's ability. So it's sort of, while there's overlap in how it presents, the actual underlying reason for that is different in those different conditions.
Yes. Okay. So it's just worthwhile digging a little bit deeper to actually find and understand the reason for it, even though it might come up functionally. It might seem functionally it might appear the same, but the strategy to address it might look different.
Yeah, exactly. Yeah.
It's really cool.
And did you find that most of the time then the core sets that were picked by families was those pertaining to autism? Were there many that were pertaining to cerebral palsy that were selected by these families?
No, not particularly. So I think, and I guess we would expect, so a lot of the cerebral palsy items were more physical. So, that was interesting to kind of look at, are there coordination or things like that come from that core set that might be relevant. And, for some children that was the case. But we also sort of thought that maybe some of those items would kind of cover around those like restricted or repetitive behaviours. But that wasn't necessarily the case. It wasn't coming up as something that was a problem for that child. And that's, because actually a lot of the time those movements can actually be sort of self-soothing or, they can actually be beneficial and enabling the child to actually like concentrate. If they're stimming because it helps them be able to do something, then it's not really impacting on their functioning. It's actually maybe enabling. So that was where we sort of expected that maybe there would be some crossover between the CP and the autism in terms of those physical things, but it wasn't necessarily the case.
Oh, interesting. Really interesting. One I found really interesting as well was listed under body structure and function was the role of motivation. And I saw that you'd written that in there as well. And I always think that when we're working with kids, motivation is such a big factor in, whether you can achieve something or participate in something else. And that seems to be can be a big limiting factor. What are your thoughts on that? How did you see the role of motivation within this context?
Yeah, so I think motivation is quite interesting, right? Because that is one of the ones that has come from the cerebral palsy core set. Because I guess maybe like you said with the codes, the coding system in the ICF is quite complex. So there's sort of 4 different levels, and motivation is that like lowest level code, and so it exists under energy and drive, which is included in the autism core set. But what I think that comes back to that sort of clarity of language is that motivation actually came up as being more of an issue than maybe energy and drive. So they scored them both, and you would think they would kind of be similar because technically that one sort of exists within the other one. But I think parents saw the word motivation and thought, oh, my child, has difficulty with that.
Okay.
Whereas maybe that necessarily didn't come to mind when they saw energy and drive. They maybe thought, oh, that, because it didn't specifically say motivation, they didn't consider it to be part of it.
I see.
And I think that's sort of maybe what happened with that one, yeah.
It's true. Energy and drive is an interesting way to frame it.
Because kids could have high energy but might not have motivation for specific, but it depends on how the parent's looking at it, isn't it?
Exactly.
If they're saying motivation to get ready for school compared to and be organised, or motivation to follow instructions, as opposed to energy when the child is, really energetic, playing outdoors with their favourite toy.
Yeah. It is. So that leads to the point about you saying, like, the language needs to be a whole lot clearer. What would you recommend along those lines based on what you saw and probably all the things you had to explain as well as parents are going through them?
Yeah, and I think that is one of the biggest things that sort of came out of this was that clarity of the language, because it is so important that if we're going to ask parents to complete an assessment, that they do understand like what it is that it's asking them and how they respond is then going to best represent their child. Because, if those parents didn't have that motivation code in there, they might not necessarily have considered it.
That's right, yeah.
As part of my PhD going forward, actually from this study, we did look at the language used in the core sets.
Okay.
Because I'm not sure how much of you've read them, but they're very high level, like scientific descriptions of things that they overcomplicate everything. So when we're giving this to parents, so what we did was we ran some workshops with like autistic adults and family members of autistic individuals.
Okay.
And that's how we then sort of we kind of workshopped those definitions and said, what does this mean to you? How could we make it clearer?
Okay.
And from there, we established a sort of a set of simplified definitions for each of these codes.
Can you give us some examples? I know it's hard to do off the top of your head, but in terms of the real scientific language that is used within the ICF and what autistic adults came up with and with the consumers, what sort of definitions were they?
So I think it was really around simplifying and providing examples.
Okay.
So, for example, I think one of the ones that came up as people not being able to understand or they required clarification on was like products and substances for personal consumption. So when you hear that, you think like, what does that mean?
Yes.
It's basically like food and medication, like things that we put in our body. So once you get that example, you're kind of like, oh, yeah, okay, that makes sense. So it was really just sort of unpacking the definitions and then cutting out anything that was sort of unnecessary and adding in some really concrete examples so that, parents could pick it up and go, oh, like I don't quite know what this is, like what the heading means, but then it said underneath food and medications. So, oh, yeah, cool, makes sense.
Okay, right. So to bring that all together then, now that you've done all that work and as we can now use that as the core set, where do you see this going? Like how do you want to use this moving forward in terms of, I guess, industry impact?
So I guess the idea was to like turn the core set into something that's more user friendly. And so, through that work, we did develop sort of an online survey version that, because I guess what we did as part of this study was quite time intensive. We would have to sit there. And it's not feasible to be able to do that. Sure. So the idea was to then, take that information and turn it into something we could then, send out as a link to parents and do sort of as an online survey. And, we sort of did that as a piloting thing as part of my PhD, but, there's still probably like so much work that we can continue to do, going forward to be able to make it like an actual assessment that people might want to use. But I think this sort of does give people a starting point for, you can actually access the core set items so like what they are from the website and then use that information to kind of, structure your own interview or whatever it is, however you're gathering that information.
Yeah. And then from there, I guess for a clinician, if you were to do this with a client or a family, you could go through these core sets now that they're written in more friendly language and devise goals or be more specific with your assessments. Is that what you're hoping clinicians can use this for? Yeah. I would hope that it would be used as a sort of like an information collection tool. And then from that information, you then, go, oh, well, these things don't seem to be an issue, but this one maybe is, or, this is a real strength for the person. Yes. How can we incorporate that in, our intervention or our support or whatever it is that we're providing? Yes. I think definitely important for, goal setting and things like that.
I really like that idea because when I remember learning the ICF, and I'm a visual learner, so I always remember the headings, and I remember underneath that environmental factors and personal factors. And imagine going through with a family, for example, those cards with the core sets on them and going through that, and the family being able to lay it out and laying out what's important to them or what, they really want to work on and address, and to be able to lay it out and put it all in front and then think about the different contributions and how it all interlinks, I think allows us to be so targeted with intervention, but also allows family to indicate where the priorities lie for them.
Yes.
Yeah. And that's at the end of the day what we're always obviously trying to get to. So I love what can come from this.
So great.
Exciting.
But also really strengths-based. I'm glad you mentioned that word as well, because it's not all just looking at the downside sometimes with the ICF. It's like, these are the problems. But if you lay it out and go, actually, no, this is a strength, and you can use this to then lever for that. And I think there is just the value of making sure we look at both points as well, isn't there?
Yeah, I think that's so often forgotten. We're always looking at how can we fix a problem, but it's like, well, actually, what can we leverage to make that easier? And sometimes that's already there within the person. It's just sort of making the time to actually find that out and explore it. So, that the ICF does provide an opportunity, I guess, because it is so broad. But it's just how you use it to get what you want to get out of it.
And you've just broken it down to that level where you can probably use it more tangibly, which I love. Where can we find this? Where can people who are listening to this find all these new definitions or links?
So I am hoping to publish the rest of the papers from my thesis.
Brilliant.
So this work is sort of all part of my broader thesis. So, it's still sort of work in progress, I guess. But you can definitely go and download the original core sets, and so you can see what items would be included.
So you can start there anyway.
Yeah, you can start there anyway. So there's still sort of that process, and then maybe this has given some ideas about how you might go about doing that.
Yeah, all the good stuff is still to come though. So we'll just keep in touch with you and make sure we find out when that does come out, and put links on our website so people can access that too. Because I think now that people know about these core sets, because it's not something we talk about very much. Sometimes we talk about, I don't know, like you said, there's the Pedicat and there's different language assessments, and you could throw a whole lot at it, which can take a whole lot of time, right? Like, I mean, you experienced it. You can take all that time, but if you've got something a bit more specific to kind of really hone in on what you can look at, you can use your funding more efficiently, and you can set those goals more effectively. So I think hopefully this raises awareness about how we can go about it.
Yeah.
That's brilliant.
Definitely.
Yeah,
I love that.
Really cool.
Thank you. I'm excited. I'm going to keep my eye out.
So is this the next steps for your research, or getting this published is probably the one part that's on your mind, but where to from here? Because I know you've got some big plans.
Yeah, so, there's still all this stuff sitting there waiting to be, I guess, sent out into the world, which is, hopefully something I'll continue to work on around everything else.
Yep.
But the next steps for me, so I have started my my postdoc research position now with the Curtin Autism Research Group, and I'm working on School Contact, which is a school-based version of the Contact Social Skills program, which I think Sonia would have spoken about.
We did, yes. It's Sonia Girdler, for everyone wondering. We have spoken to her about this before, but you've got the next stage.
Yeah, so we're now taking that into schools and to see if that's, something that supports students in the school environment in specialised learning programs for autism. So
that's amazing, because it's great evidence around it when it comes to social skills and I guess just making friends. I remember Sonia talking so passionately about that, and that's what you're doing now.
Yeah, so that's sort of the next step for our team. But hoping to continue to kind of work on my getting my PhD stuff out on the side. So
I think it's so vital, so important. Yep, because I want to see it. So please do it. Look, we're not done just yet. So hold on to your horses, everyone. We're going to head into our last segment, Tell It to Ed. Ed is our producer. He doesn't have a background in child health, but he has been listening. He's been, I'm sure, taking notes. This is an area we haven't spoken about before. So before Ed has an opportunity for a question, Maya, can I get you to summarize what we spoke about in about 60 seconds or so? And Ed, you'll have time for one question. Okay. Take it away, Maya.
Oh, okay. This is dress. So I guess what we've spoken about is this work looked at developing a sort of a tool to use to measure functioning of school-age children on the autism spectrum using a sort of an established framework to look at different areas that might affect functioning. And what we found was that generally in terms of our sort of body functions and activities and participation, that those sort of aligned with what we thought with the Autism Core Set, but that maybe some of those environmental factors might need to be sort of considered in terms of how they are impacting on autism as well.
Cool. Good summary. Nice timing. Wow. Ed, over to you.
So today's episode's been great. It's a conversation and a topic that I don't know very much about. Actually, I don't know a lot about most of the topics that we're talking about. During the pod and on occasional episodes, I do pull up the links to the papers and have a quick read through it and realise I know nothing of what's actually in that particular document. But on a very cursory kind of look at it, I guess my question is about I don't know if I'm going to get this right or not.
Have a go.
About perhaps some gaps that might be in the core sets, the ICF core sets for autism. So I know that the paper mentions things about motivation and cognition or cognitive function. So if I'm on the right track, how do you think addressing some of these gaps might improve the support or the resources that are provided to kids or children on the autism spectrum?
Yeah, okay. Good question.
It is a good question, yeah.
Yeah, I think what's really important is that, we do consider those other things that might be, and I don't necessarily think that there are a gap in the core set, but maybe something, because as I was saying, sort of motivation is technically included, but just being really clear about, what each of those items actually does mean so that parents are getting an opportunity to, one, report any issues in those areas, and then two, clinicians can then respond to that and make sure that they're supporting the person in the best way that they can. And I think a way around that at the moment is actually, if you do download the sort of documentation form from the ICF website, you can it's like a build your own adventure sort of situation where, you can select a core set and then add in any individual items that you think might actually be relevant. So, that might be something that, if you've sort of spoken to a family and you know that there's a specific area that maybe is not included, that you might want to look into further, you can actually just sort of slot that in and make sure that you don't miss anything that way.
Okay.
I get it. That's cool. I want to build my own. Have a look.
Yeah.
But I guess there's no gaps in what's actually included in there. It's just a matter of us actually going through it and like trying to search that out. Yeah, great question, Ed.
Thank you.
Yeah, thanks, Ed.
Well, thank you so much for joining us today. It was so lovely to have you in the studio for your first podcast.
Yes, I know. Thank you so much for having me.
Oh, it was
You were great. It was such a conversation. I have more questions, but
yeah. We'll start there and we'll get you back when everything else is published. So we'll keep in touch. Look, to all of our listeners, if you want to access this article, we'll put links for this on our website and researchworks.net. And of course, as per usual, we have a CPD form there that you can fill out as well if you want to keep this as part of a record of your PD requirements. And I'll probably try to put the ICF link there too so that people can actually have a look at those core sets.
Yeah.
I mean, I think you can Google it. It'll probably be faster, but I'll put a link in there. Anyway. But to all of our listeners, thank you so much for tuning in. We hope you really enjoyed it. We've got so much more to come, so have a great week ahead. And thanks again, Maya.
Hey, thank you.
And we'll talk to you all again really soon. Bye.
bye.
Bye.